Hey mothers, let's talk about cold, flu, and COVID. Does your child have a fever, a sore throat, or a cough? And you're wondering if it is COVID 19, could it be the flu or just a common cold? Well, all these illnesses are caused by viruses which infect the respiratory tract. All of these are contagious and can spread easily from person to person. They cause some similar symptoms, hence, it can be difficult to tell them apart. Here are some things to look for if your child gets sick. Number 1. The common cold. Cold symptoms are usually mild. They often include sore throat, runny or a stuffy nose, sneezing, and if there's a fever, it's not high. A child with a cold usually feels quite well and has a good appetite and normal energy levels. Number 2. The flu. The flu can also be mild. Usually, kids with the flu feel worse than if they have a cold. They might have a fever that comes on suddenly along with chills, headache, and body pains. They can also have sore throat, runny nose, and cough. Number 3. COVID 19. Kids infected by coronavirus may not have any symptoms, or their symptoms can be mild like those of a common cold, while some can have more severe flu like illness. So, mothers should look for these important symptoms: fever, usually high, a continuous cough, loss of taste, loss of smell. So, what should you do to prevent your family from getting sick? Common steps that help prevent the spread of germs also work well against the common cold, the flu, and COVID 19. It's always wise to frequently wash your hands and ask your family members to wash their hands too for at least 20 seconds with soap and water. Or use an alcohol based hand sanitizer when soap and water are not available. Clean surfaces that get touched a lot, like doorknobs, phones, and counter surfaces. During the coronavirus pandemic, everyone in the family should avoid large crowds and busy places, maintain a 6 feet distance from people, and always wear a mask outside and in gatherings. Keep your children at home if they're sick or came in contact with an infected person. Call your child's healthcare provider to discuss whether your child needs to be evaluated or tested for COVID 19. Mothers, do not forget to take care of yourself while taking care for your family. So, when should you call a doctor? If you have any doubts or questions, it's always best to call your doctor. An illness that seems like a cold can turn out to be flu or COVID 19 or the other way around. Get medical care immediately if your child has trouble in breathing, pain or pressure in the chest that doesn't go away, a confused mental state, difficulty waking up or staying awake when not tired, and bluish discoloration of lips or face. Thank you.